Dr. Gary Johnson, a clinical audiologist in sunny Scottsdale, Arizona. Our video today is going to be about commonly asked questions that we receive in the clinic. To help me out today, I have my son Axel here with me.
Hi, I'm Axel and I'm playing the part of the patient. Gary, does insurance cover my hearing aids?
I wish there was a standard answer to this question. Unfortunately, there isn't. A lot of insurance companies cover hearing aids, and a lot of them don't. It really depends on which particular plan you're on. For example, if you're on a United Healthcare plan, for instance, and your neighbor is on a United Healthcare plan, but those plans are different, one of you may have coverage and one of you may not. The only certainty when it comes to hearing aid coverage is in Medicare. Medicare does not cover hearing aids. Hearing aids are an exclusion under federal Medicare. However, supplements and secondaries may provide some coverage for hearing aids. Remember, not all coverage is the same. Some companies have coverage through third parties or have markup markdown games, and some companies have actual financial coverage. To determine what your coverage is, you need to speak with your hearing healthcare provider and make sure they're in network with your health insurance, and then have them verify your benefits. Or take the time to call your health insurance company themselves.
Is there really a Bluetooth option on my hearing aid?
Absolutely. Bluetooth connectivity is pretty much a standard feature with newer hearing aids. This Bluetooth connectivity allows you to connect directly to your cell phone or to other accessories such as microphones or even TV connectors. Talk to your hearing healthcare provider to learn more about these different options depending on exactly which hearing aid you have.
Why do I need 2 hearing aids? I believe one is enough.
Axel, there are really only 3 reasons why people go with 1 hearing aid rather than 2. The first reason is medical. If for some reason one ear is not suitable for amplification, or if one ear is normal, then we wouldn't fit both ears. You only fit the affected ear. The second is social. This reason's kind of silly. If you're ready to wear 1, you should be ready to wear 2. When you look at me right now, you can only see my right ear. When you look at me right now, you can only see my left ear. The only time you get to see both is when I'm facing directly at you, or if you're standing right behind me. So most of the time, people don't see both of your ears. They only see one. So unless you're planning on walking around like this all day, every day, wearing 2 instead of wearing 1 really doesn't make a lot of sense. That's backwards. Wearing 1 instead of wearing 2 really doesn't make a lot of sense. The third reason is financial. Hearing aids are costly. They are an investment in your health and hearing. Treating 1 hearing impaired ear is definitely better than ignoring the problem altogether, but likely not going to give you the same benefits as wearing 2. I mean, come on. We walk around wearing glasses rather than monocles.
Gary, do you ever recommend 1 hearing aid?
Yes, we do recommend 1 hearing aid occasionally. The usual reasons that we would recommend 1 hearing aid are medical. If 1 ear is completely normal, or 1 ear has no comprehension abilities, those are 2 times where a single hearing aid may be appropriate. The other time is when a patient discloses a financial hardship. Hearing aids can be expensive, but they are an investment in your health and hearing. Treating 1 ear is definitely better than doing nothing, but usually not as good as doing both ears.
Why are there different styles of hearing aids, and which one do you recommend?
There really is no best. There's no best style, there's also no best brand, and no best model. It really depends on what your lifestyle is. There is best for you, but best for you may not be what's best for me, or best for your brother. What's best for you will be determined by your lifestyle, your social needs, and a whole lot of other factors. you should consult with your hearing healthcare professional to help to determine what brand and style is right for you. Well, Axel, thank you for taking the time during this quarantine to play our patients. It really does help to make the videos better and hopefully educate the people out there about concerns associated with their first appointment of visiting a hearing healthcare professional. So are you ready to jump into the workforce yet?
Not really.
Why not?
Too much work.
Well, at least he's honest. As always, hear well, live well. And if this video has been helpful, please like and subscribe.
And comment down below if you have any questions.